Well, I'm Nick Petro, the founder of P3 Baseline, and I have Dr. Mike Pierce here today. And I just wanted to dive right into this. So, P3 Baseline, we just administered baseline scans to student athletes in hopes that this is an objective answer to a subjective measure for concussion protocol. Mm-hmm. And I know with our baseline assessments, we also have, it's an EEG, it's a portable EEG. The brain scan can be done in about 4 minutes. It's also a P300, which is an evoked response potential intermittently throughout this assessment. Mm. At the end, after that 4-minute EEG is done, then there's trail making A, trail making B, connecting the dots, the numbers, and then flanker tests, different mental health assessments. So it's a really robust platform that we have. We're working with schools, universities, we're working with sports organizations, clinicians, we're actually working with a lot of people and trying to just get an objective baseline measure across the United States for ages 5 and up, all the way to our elderly, our aging population as well. That said, I actually got my own report done. I had a WAD report, I did a baseline scan, and this was done back in October. And so Mike, thank you for joining us today. And this is it. I mean, this is absolutely incredible. Not only is it portable, it's fast, and it's an affordable kit. It comes in a bag, and this is it. I mean, the helmet itself was designed by the co-founder of Crocs shoes, so it's a very comfortable helmet.
So Crocs makes this, doesn't it?
Crocs does make this, and we have these little e-socks. You just kind of soak these in saline solution. You pop these inside the helmet, and then you put the helmet on the patient, again, over about 4 minutes. This kind of compartment right here actually houses all the data. It actually plugs into the back of the helmet.
This one?
Yeah, like that.
Oh, yep.
And then basically we have headphones on after we put it on the patient. It's driven right to the laptop here. It's just a simple laptop, Dell laptop. It's all touchscreen for some of our mental health assessments. And then it's all cloud-based as well. We can actually get a report done on what my brain looks like in 4 minutes. Dr. Mike, this is absolutely phenomenal. Talking about revolutionizing the way that we treat brain health and to make it affordable for a common person. So, like I said, I got this done, but I wanted you've seen the report, we've kind of went through what does my WABI mean, and I just want to maybe touch a little base on why is this so important to the work that you do and the patients that you see on the rehab side. Sure. Why is this, in your opinion, going to be something that revolutionizes the way that we treat brain health?
Sure. Well, this is Nick's scan, and this tool, this device is the first device that combines EEG and ERP together, which is the resting brain and the active brain. So that's a pretty exciting thing. It's also very inexpensive to apply. These machines usually are very expensive and their scans are very expensive. This is a revolution in pricing. So it's attainable for the small practice that isn't an institution like a hospital, doesn't have a huge budget for massive machines, and it also is accessible for the patient because it's affordable. So now getting to Nick specifically, this test is not a diagnostic test. It's not designed to diagnose a person. It's approved by the FDA as an adjunctive diagnostic tool that's allowed to help with the assessment of a person. And so you're a pretty lucky guy. Your test here shows that that you were tested recently, and your P300 delay, which is the delay after you hear an oddball sound in your ears, your delay was within the normal range. So you didn't have a problem.
I got lucky with that one.
So yeah, you didn't have a delay on how long it takes for your brain to process beep 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 that oddball sound. That's the delay or timing. The P300 voltage is the one that has to do with the amount of voltage that goes through those same areas of your brain. And your voltage was at the bottom range of normal. Now there's quite a large plus or minus fudge factor here. So I don't want to put too much weight on this. I would just keep an eye on it. I would say you're within the normal range, and this could be noise, and you don't want to overinterpret any lab test or any imaging that's done on a patient. But what you do want to do is say, what would I keep my eye on as an experienced clinician? I'd keep my eye on your voltage. If you ever get hit again, or if you ever feel like you're having a down day, I'd throw you on the WABI and do a 4-minute scan, and I would see if your P300s had changed for the better or for the worst. And those can be affected by blood sugar too, by the way.
And to that point too, so blood pressure has something to do with it. Maybe if I was driving and got in a car accident, whiplash, concussion in sports.
Yep.
What about trauma? If maybe somebody in my family passed away,
Yes.
or I was really anticipating something, a business transaction to go through and it didn't, or some sense of failure or severe depression. Could all these affect that? So, and I keep playing with this. This is really cool, this ESOC thing. I mean, I just can't get enough. It just goes in there. We dispose them after it.
Oh yeah, these
awesome.
are disposable,
So,
by
yeah.
the way. These are disposable. These e-socks. They're calling them e-socks because they're disposable and they're little nylon things, and they get soaked in salt water and they slide into each of these 19 electrodes, and then you pull them out and throw them away when you're done. And they're working on a wonderful recycling program for them as well. And of course, the helmet is reusable. That's a nice idea. That the cap is reusable. We call it a cap.
Yeah.
So let's get back to your statement. You said.
What are all the indicators on the P300? So, for instance, mine is on the lower end as far as the voltage, and it could increase maybe over time, or it could actually lower, and those are alarming factors potentially if I was in a concussed state or severe depression. What are some indicators that voltage would decrease?
You really had it when you first went through that explanation a minute ago. You really, but before we did the ESOC thing, you really had it down. There's a lot of research on P300s and a lot of research on changes that happen to them from things like blood sugar, from things like emotional trauma, from things like physical trauma, like a blow to the head where your head actually strikes something, versus a whiplash where your head doesn't strike anything but it whips. And so if the head and neck whips and the brain sloshes inside the skull, that can also affect this. So you see it in ADHD, you see it in emotional trauma and disappointment, you can see it in infections and encephalitis, when a person gets a viral infection or other kinds of infection that affects their brain. There's a whole host of things that can cause these P300s to change. So yeah, it's a great way to monitor your health as you age as well. Nick's not very old here, but if he was an elderly guy, we'd be looking at that too. This is important for aging because P300s change as you age. They change slowly as you age, and you can expect a little bit of slowing and a little bit of reduction, but not too much. Not too much. Aging. Remember, age is not a pathology in neurology.
So this system that we have here, this portable, affordable, fast, Wavi system that we administer through the P3 Baseline company, is for ages 5 and up. I mean, it's for everybody's, potentially their yearly health and wellness, as just a check, as a yearly baseline, even if they didn't have trauma in their life.
You're right, and they talk about that in psychiatry. They say that it's the only profession that doesn't measure the organ that it treats. Everybody else measures. Cardiologists, they hook you up and measure your heart in a bunch of different ways. Mm-hmm. Orthopedic doctors X-ray and ultrasound your joints and use MRI, and every other doctor.
Plenty of those.
Oh yeah.
Sports injuries and so forth. Yeah.
Blood work for your liver, your kidneys. I mean, there's tests for everything.
I've never had one done, Dr. Mike, until now on my head, which doesn't my brain kind of control the rest of my body?
And you've already had how many concussions?
I've had 2 that I was hospitalized for, but I know without regard. I mean, I played soccer competitively all the way through college, played in some semi-pro leagues afterwards, and I've had a series of concussions.
Yeah.
2 that were a little worse than others, but by and large, I'd say most athletes, even when I was playing sports, you just didn't go to the hospital if you felt like you knocked heads with somebody. Especially in football, you just kind of put your pads back on and you go back in.
Yeah.
But we're finding that concussion, especially amongst youth sports, is up 500%.
Yeah.
It's an alarming number.
Amazing.
And so the more and more that we know about concussions and brain trauma, especially in the mental health indicators as well, hopefully we'll get into that right now, we see this convergence of more and more concussions amongst youth sports all the way up to our pros, along with mental health indicators, ADHD, depression, and some of the other people that you work with. Are we seeing a trend in concussions continually going up and mental health indicators going up? And I see this potentially as that one marker that gives an objective measure to such a subjective industry, if you will.
Oh, sure, yeah. To your question about are we seeing a convergence, and not only are individual conditions elevating and raising in frequency, but there's something that we call comorbidity or dual diagnosis, where a person has two illnesses layered on top of each other. So, just recently I had a guy that came to me that had Lyme disease, and we found statistical measures of concussion on top of his Lyme disease. So he's got all these brain symptoms. He's trying to figure out his life, and he's taking supplements and drugs to try to fight the Lyme infection, but he didn't realize that he also had a concussion. So you also see this with kids that have a long-standing ADHD diagnosis, and then they come in and we scan them, and we find that they've got evidence of concussion too.
Oh.
So ADHD plus concussion. So you'll see these dual diagnoses. You'll see mental illness having dual diagnoses, where a patient might have an addiction problem and a hepatitis, or you'll see a person that has PTSD and a concussion. You'll see a person that might have Alzheimer's and Parkinson's. I mean, there's all kinds of things that go together. So you'll see a lot more of that layered on top of diagnosis on top of diagnosis.
Thank you, Dr. Mike. And
Sure.
a part of my assessment in this quick 4-minute assessment that we've kind of gone over here, but I was also on this laptop, which is there's this touch screen, and I did some trail making. All I had to do was literally on this screen find number 1, 2, 3, 4, all the way up to 20. I think it was 25, 24, 25 numbers, and I just did it as fast as I could. And so that was relatively easy because clearly I'm not in a concussed state when I was actually taking that assessment. And the second one was a trail making B right here.
Yep.
Time was a little bit slower, but I had to remember, and it was a little trickier. So it was 1A, 2B, 3C, all the way up to the number 13.
Right.
And so that took a little bit longer. And again, I was kind of within the range on both of those. I was a little bit quicker on the trail making A, a little bit slower on the trail making B. And then there's some other indicators below on when my eyes are closed, my theta,
Sure.
beta, and so forth. But I'd like to maybe concentrate real quick on here. We've scanned hundreds of athletes and students, whether they're student athletes or just students as well as elderly that aren't in a concussed state. But what we found in our scans, in the baseline scans, that these numbers are way off the charts when somebody's in a concussed state or somebody's severely depressed.
Yeah.
Is that true?
Oh yeah. Yours are good. You've got good trail making A and B, which is short and long, easy and hard. And your they didn't do that one. Your CZ ratio of theta to beta ratio, which we talked about a little earlier, is right in the middle of normal. And your F3 F4 ratio is actually on the high range. So for you've got F3 to 4 is on the high range. It's supposed to be 0.8 to 1.2. Yours is 1.3. So it's a little bit on the high range. So that means there's a lot more F3 than there is F4. Because it's a high ratio. So that means there's more alpha coming out of this side of your head than this side of your head, and that imbalance in frontal lobes can be a symptomatic type of thing. So we would ask you questions about your anxiety versus depression experience. We'd ask you about your processing of daily activities. Brain fog is a big one. Everybody uses the term brain fog, and it just means feeling fuzzy. We would ask you about your drowsiness and alertness. We would ask you about your ability to do math and to have word finding capacity. Are you capable of finding words, or do you get clumsy and feel like what's that word I'm thinking of? It's a big animal with a trunk and giant feet. Oh, an elephant, that kind of thing.
Yeah.
You know what it is, and you can see it in your head, but you can't think of the word. So those are all some of the things that we might consider. And of course, don't forget blood sugar. Blood sugar can be a factor that affects athletes as well as brain performance specifically.
So you can find out a lot of information from a quick baseline scan, is what you're saying. This is really robust.
You can track a lot of functions about the brain.
And so based on the findings, if the findings are maybe a little bit alarming, right, based on the range that we produce on every scan that we do from every age bracket, if there's indicators that are super low or super high, then that maybe it's just first line of concern, if you will.
Yeah.
And so that's when we speak to somebody like yourself, a professional, that can kind of help facilitate what now.
Yeah.
What next.
That doesn't constitute a diagnosis, but it does constitute something that you keep your eye on. What you're seeing emerge in the market of American families and healthy people is something called functional medicine or functional neurology. And the idea of that is most of the time there's nothing medically wrong with your brain like Alzheimer's or Parkinson's or a fractured skull. Most of the time people don't have one of those strong, powerful diagnoses. They've just got some dysfunction, some imbalance, something that's uncomfortable, something that's affecting their daily performance that they don't like.
Sure.
Their brain isn't like it used to be.
Right.
And so that's called a functional assessment, and it doesn't rise to the level of needing to be a diagnosis, which means it's not paid for by insurance. It's usually a cash type of intervention, but people want to do something about it. They want to find it and they want to fix it. And so this represents a way to do that in a scientific way that's reproducible and not easily made fraudulent. Like if I just told you, Nick, I'm a psychic healer and I'm going to scan you and I'm going to see what's wrong with you, which I'm not. I'm not, right? But let's pretend that I was. There's no way for you to check me to find out if I'm lying to you or if I'm truthful or not. Maybe I do have that ability and I can't teach it to anybody else. Maybe I don't have that ability. But there's no way for you to verify how accurate I am from patient to patient to patient and from visit to visit with you yourself. But with a machine like this, we can have reproducibility and reliability so that we can say these measures are actual functions of your brain, and they're not diagnostic, but they are indicative of your function. That's what you want out of life anyway.
And that's a great point, because, I mean, I'll be honest with you, there's a lot of people that false claims, right?
Yeah.
Left and right, especially in functional medicine, where I live in Southern California here in Encinitas, and I can go up and down the coast, and it seems like every other shopping center there's somebody in some type of either functional medicine or palm reading or what have you.
Intravenous therapy.
Yeah, and I'm just wondering the validity. I question a lot of things, so I'm just wondering the validity behind a lot of what people say they can do.
Yeah.
And it seems like the industry in itself, potentially by and large, is pretty subjective.
Yeah.
So this literally brings some data to a subjective world, so to speak.
Yeah.
And you can track progress over time working with the patient.
Yeah, I don't want to throw the baby out with the bathwater, and the idea that there is modern medicine, which is very, very science-based, but sometimes it smacks of the medical industrial complex where there's profit-driven corporations that are doing all kinds of shady things, and the pendulum swings both ways. It swings toward heavy science and heavy industry, but it also swings toward complete voodoo and crazy unsubstantiated claims. What we think is that alternative medicine and holistic medicine and functional medicine should fall in the middle between those two swings of the pendulum. We don't want it to be medical industrial complex and overutilization and profit driven chemicalization of patients and over surgical procedures to people. We don't want that world. But we also don't want a world where it's complete faith healer mumbo jumbo. We don't want that kind of thing either. So we want to try to strike a middle road in there where we're using science to show that there's dysfunction, but it doesn't quite rise to the level of diagnosis. And there's still some old school doctors out there that say if it's not a diagnosis, it's not real. And I don't believe that, because, for example, you've been a coach and you've led a lot of kids. When you work with children and adults and you measure some performance of them, like how fast did they do 5 burpees, or how fast did they do a sprint, or how fast can they do any particular activity, or how high can they jump on their plyometrics.
Sure.
Those don't diagnose disease, but they measure performance.
Absolutely.
And this is the same idea.
Long.
Yeah, this just measures performance. And so what we're doing is we're saying you don't have to diagnose somebody, and you don't have to have a tool that's classically diagnostic to be useful. Because a coach isn't diagnosing a patient,
Absolutely
he's finding
not.
the imbalance.
And that is, I think you hit it right on. And that's music to my ears, because I've been in coaching sports and youth, and been around college sports as well, but all the way down to kindergartners. I taught PE, all the way to motivational speaking and traveling and working with just a lot of kids and adults and young adults as well.
And
so
executive workshops, didn't you?
I've done a lot of that.
That's
yeah.
right.
But even in the sports world, that's music to my ears, because I don't need to be an MD. I don't need to have a lot of medical background for me to understand where I'm at with my head.
Very good.
Right?
Very
I mean,
good.
we're talking, could parents easily understand what this means by having this sheet here and then a printout, a sample report? By the way, this is all PDF driven. I can do a scan and have a report, a picture of my brain on my phone.
Yeah.
I mean, driven on a PDF with seconds after I get a report. That to me, that blew my mind. And then second to that is that now I have all the students that I work with and all the athletes I work with, all the sports world that I'm connected with, and the mental health side. This is that convergence, like we're saying, where in the sports world, Dr. Mike, I can't tell you how concerned I am for student athletes that are going back to play after they've been in a concussed state, and their physicians signing their return to play because they supposedly they have to wait. The mandate here in the state of California is 2 weeks. You get a concussion, you have to be out 2 weeks. By and large, there's a lot of subjective measures that their doctor, their physician will sign off on. Could this be a tool that would prevent potentially hundreds, thousands, if not potentially millions of kids going back into their said sport, which could potentially open up for a second, third concussion, maybe long-term permanent brain damage? I mean, we're talking finally, an objective scan, a measure to a subjective world that we're seeing the mental health indicators from student athletes and professional athletes going back into their sport too early.
Yeah, it's very important to have an objective measure, and while it doesn't diagnose or by itself clear a student to return to play, it's an extremely important objective measure, because right now people are just rolling the dice. They're looking at some pupils and squinting at the patient and rubbing their chin and saying, maybe.
Or how do you feel?
Yeah, how do you feel? Are you ready to go back to play? Yeah.
Of course, I'm going to say, I'm ready to go back to play.
And they all
that
are.
day. Yeah. But we're all about protecting the brain, the longevity of our athletes, as well as our aging as well.
So a tool like this helps the athletic trainer not become the bad guy, because the athletic trainer is often seen as the bad guy when they say you're not ready to go back to play. And the students, whether they're college level or high school level or any level really, they always want to hide from the athletic trainer because they know they're going to be pulled if they have any symptoms. Whereas if they can trust their relationship with their athletic trainer and they can do things like this, then they're not going to be in this adversarial, withholding information and not really telling them how they're really doing. And that's devastating for their future, because most of these kids aren't going to be pro athletes. Most of them are, though, going to have a career that uses their brain. And so for them to temporarily hold back information so they can return to play sooner and hide an injury from their athletic trainer and their coach and their parents, it could be devastating for their futures.
I say those times are behind us.
Yeah.
Now with this new